Hi, I'm Dr. Alex Ye, and today we're going to be taking a look at a live surgery, which involves the surgical extraction of an upper molar and the subsequent socket preservation bone graft for a patient.
So right now we're just getting set for the surgical extraction and socket preservation graft for tooth number 16. This tooth has had a failed root canal, and the patient is now wanting it to be extracted with a socket preservation bone graft and subsequent implant. Here you see us sectioning the tooth. So usually I section the coronal portion first, which means I cut off just the crown part of the tooth. So I'm using a air impact drill which blows the air out the back of the drill, and it's at a 45-degree angle. Here I'm just splitting the crown off. There's no crown, it's a natural tooth, but it's the crown part of the tooth. And typically I will isolate the mesial and distal roots first, and then carve out the palatal root prior to elevation. So the sectioning is essentially splitting the tooth exactly where the roots are. Here I'm using a luxator to elevate, and then once it's loose enough, we use the forceps. So here I'm removing the distal root, which unfortunately fractured, so I'll have to get that root fragment out later. Now, so that we got the mesial root. Usually I'll get the distal root because typically the distal root is straighter on upper molars, and that's the rest of the distal root fragment. And the palatal root usually is just like a forcep removal. We just do a twist and pull. So the socket's pretty clean. However, we want to make sure there is no granulation tissue there, because we know that this root canal has failed. And so I'll use a curette, and I'll get all the way down to the apex, or where the apex used to be, and then we'll rinse it out with saline, make sure it's just all bone in there. And so I try to visualize all the way to the bottom and make sure I see bone, and that helps ensure that we have a nice clean socket with no granulation tissue or no infected tissue. I think I'm still just cleaning out the socket here with saline. Although it is a risk when you remove upper molars there's a sinus perforation risk, which I explained to the patient initially. We did not perforate the sinus in this particular case, and thankfully that rarely happens. So now we are putting the bone graft material in the socket. I believe this is a coracal cancellous mix, and I'm using Raptos bone grafting material. The brand is called Raptos. And so I like to pack the bone in quite densely. So I'll use the condenser, and then I'll also use like a small condenser, or sometimes even a perio probe, and I'll go into the socket, and I'll make sure that the bone is getting packed all the way down to the apex of the socket. Here I'm putting and I don't always do this, but I'm just putting a collagen plug first, and then I'll put a collagen membrane right after that. Sometimes we'll just do the membrane and and in smaller sockets I'll just do the plug. The purpose of the collagen plug and membrane, for those of you who do not know this, is to prevent the epithelial cells from migrating into the socket before the bone has a chance to grow in the socket. So it acts as a barrier. So I'm refreezing the palatal region, and just ahead of the suturing, because I know that will be suturing, and the suture will puncture the palatal tissue. So I'm just making sure that he's frozen. I usually do like a continuous suture, which it's kind of like a crisscross, like a modified mattress suture almost. That's what I usually do. So that's all done, and here's the before and after. You can see that the graft material is quite dense, and we are good to go. I'll give them these post-op instructions, take some photos.
So hopefully you enjoyed that video. If you have any questions, you can find us at smilesdentalgroup.com, where you'll also find our contact information, where you can call and book a free consultation regarding implant surgery. If you enjoyed this video, please subscribe or like or share it with your friends, and we'll see you next time.